Started your 10 minutes time.
Okay. Hello, I'm Dr. Taskeen, one of the doctors here today. Am I speaking to Mrs. Geeta Patil, 32 years old?
Yes.
Okay, how may I address you?
Geeta is fine, doctor.
Okay, Geeta, I can see that you're alone. Will your partner will be attending us soon?
No, he's busy today.
Okay, Geeta, I can gather from your notes that you're here today to discuss about your results, investigation results. Am I right?
Yeah.
All right. And do you have any other concerns or expectations out of this consultation today?
Actually, I'm really fed up of doctor. Since last 1 year, the referral from a small hospital took 1 year of time to be referred to a big hospital. I am already keen on getting pregnant, and I think my biological clock is ticking. It's very difficult. It's very frustrating. I'm really very disappointed.
Yeah, it's understandable. Yeah, this time would have been very upsetting for you. I'm so sorry to hear about this, Geeta. And now, definitely, I'll address your concerns and we'll discuss the reports with you and formulate a safe and best plan for you. Is that, Miss Geeta, is it okay if I ask you a few questions as if we're meeting for the first time, please?
Yeah.
Okay. Can you tell me more about the concern? Like, have you tried any treatment so far?
Uh, Doctor, actually, we are married since last 6 years. My husband is 40-year-old. For
Mm-hmm.
4 years, we were not keen to have a baby, so I used oral contraceptive pills. After
Okay.
that, I started planning, but for 1 year there was no luck, so I visited a GP. The GP visited me to a smaller hospital, and then they asked me to see a bigger hospital. So after 1 year, I got investigated, and I'm here to discuss my reports. I don't know what are there in the reports.
Definitely, I'll let you know in a moment. And when was your last menstrual period, Geeta?
Uh, it was 2 week back.
A week back. Okay. Sorry to ask you if you need an interpreter or you're comfortable with this.
No, it's okay, doctor. I'm comfortable.
Okay, thank you. And what about your periods? And any problem with that?
No, doctor. My periods are pretty regular. They're bang on time, and my last period was 2 week back.
Okay. And are you updated with your smears?
Yes.
Okay. Can I ask you a few intrusive questions that are important for your management?
Yeah.
Okay. Any problem with your sexual life?
No, never. Although means my husband is away most of the time because of his business trips, but we do have a frequent intercourse.
Okay. And any problem with the erection or ejaculation of the
No,
partner?
no,
Okay. And do you have any history of sexually shared infections in you or your partner?
no,
Okay. And you have either of you parented a child before?
no.
Okay. And okay. And do you have any family history of concern?
Uh, my family, my mother is having diabetes, and my that's it actually. And my husband's side, my sister, mother-in-law is having stroke. Apart from that, no significant history.
Okay. Any medicines you are taking currently or in the past?
The GP started me on folic acid.
Really? Okay, that's good. And any allergies?
No.
Any
Yeah, I'm allergic
surgeries?
to egg. I'm allergic to egg.
Okay, okay. Any surgeries in the past in the tummy or down below?
Yeah, doctor, I had been operated for a appendix infection, but it was diagnosed within a couple of time, and I got quickly operated by keyhole surgery.
Okay, okay. And how was the recovery thereafter?
Everything was fine. I went home in the very next day.
And are you aware of your weight to height ratio?
It's 24.
Okay. And do you smoke?
No,
And what about alcohol?
occasionally, not routine.
Any recreational drugs?
No.
And how's your support at home?
I do. Both of us are very supportive towards each other, so not having any concern.
All right. And Geeta, have you been vaccinated for rubella?
Yeah.
That's nice. And as I can see that you're in a lot of distress, do you feel low mood or like depression-like symptoms in the past 2 weeks
No,
or
no,
okay, that's good. Thanks for sharing this information. Would you like anything else to add on?
no.
Okay. Geeta, can I just quickly examine you in the presence of chaperone? My nurse will be taking your pulse, blood pressure, and I'd like to have your general examination.
Okay.
Okay, thank you so much. Okay, Geeta, I'll be just now discussing your result reports, and it includes your reports as well as your partner's. But for your partner report, I need the consent of your partner.
Yeah, he
Has he
has
given?
consented. Yeah.
Okay, that's fine then. Okay, coming to your blood investigations, I have just confirmed your name and an registered number, and they belong to you, Mrs. Patel. And it has shown that there is there's some blood tests at the brain hormones which are responsible for ovulation and the normal brain hormones. They are quite in normal range. Your thyroid function is normal, and other hormone which suggests is that the egg release is there. Okay, I want to confirm you whether this test was done on a specific day of your periods.
Yeah, day two of menses. And
Okay.
few tests were on day two, and then few were on mid
Okay.
cycle after 3 weeks.
Okay, okay. And also your screening for infections that is negative, and your but your test for rubella is showing no antibodies. So as you were telling that you were vaccinated for rubella, am I right?
Yeah, I think yeah, I have been vaccinated.
Okay, look into that. Okay, otherwise it should have seen maybe IgG antibodies. I'll look into that this test again. Now, coming to your investigations of your scan report, that is again a normal. You have a normal uterus, you have normal ovaries. Okay, and about the test report of your partner, I have confirmed his name and NHS number, and this may get the page, please. Yeah. Okay. Can I know what is the name of your partner?
Yeah, he's Samuel.
Okay, so I confirmed your name, the name of your partner and NHS number, and for everything is fine with him also. Okay, so
Okay.
yeah, did you went for any test for your tubes, fallopian tubes? Any test was done for that?
No.
All right, thanks. Yeah, so all these investigations are normal. Okay, Mrs. Patel. So, however, we may need to suggest one more test for you that will show us the patency of your fallopian tubes. I will just show you on the diagram that you know this is the womb and these are the ovaries. Then these are the fallopian tubes which connect the ovaries with the tubes. Okay, so in order to look for a cause, we need to rule out its patency, whether it's okay or normal. And has anyone discussed about you some dye, X-ray dye test?
No, doctor.
Okay. Would you like me to tell about that?
No, it's okay. I just wanted to know what are the probable cause for my me not getting pregnant and how you are going to offer me treatment.
Yes. So, as per the investigation till now, we couldn't find any cause like your husband's semen and your tests are normal. Apart from the one test which I was telling you, that is the tube test. Okay. So, in order to look for that whether tubes are working or not, we may go for another test, which is the HSG. It's actually an X-ray dye test where we inject the dye into the neck of the womb and just visualize it through an X-ray to see whether the tubes are patent or not. Okay?
Okay.
Yeah. So if this is also fine, and then we call it as an unexplained infertility. Uh, would you like me to tell more about this?
Yeah, doctor, what actually it is? What is it? What is it? I haven't heard about it.
Yes, please repeat.
I haven't heard about it. What it is?
So, what we see, like in many patients, okay, we don't find the cause. okay, after rolling out or investigations, and after they have been on a 2 year without any protection, they have been doing the sexual intercourse. So we call it as an
Your
unexplained
time is
infertility.
up. Your time is
Oh,
up. I'm giving you another 2 minutes.
okay. So, if this is the reason, then after 2 years, when one couple doesn't conceive after 2 years, even after all the tests are normal, then it's recommended to go for a assisted conception. That is where we assist the couple in getting pregnant. A technique called as test tube baby. Have you ever heard of this before?
Yeah.
Yeah, okay. So it's done. It's done in an assisted reproductive center where there's a proper protocol. And before that, we also advise some lifestyle measures to be taken. Like in your case, everything seems to be fine. You're not smoking. Your weight to height ratio is okay. So advise you to continue with optimizing your weight and healthy diet. And thereafter there's a list of steps which we undertake in this technique so as to make you pregnant. So in this technique we take the eggs from your from the patient's ovaries and just fertilize them with the partner's sperm in a lab, in a special lab. Thereafter, once the pregnancy occurs, this is then injected back into the womb. Okay, am I clear to you so far?
Yeah, doctor.
Yeah. So it's injected back into the womb, and some drugs, medicines are given to support the pregnancy. Okay.
Hmm.
Yeah. So although this is successful in around, it depends on the age as well. As we have seen, it is successful in around 30%, 30 out of 100 do they have the live birth. However, uh, However, there are some, some problems with this also. Like there can be a multiple pregnancy, or there can be the chances of the pregnancy developing in the tube, or sometimes the failures, which I told you. Okay.
Okay. Okay.
Yeah.
And what about cost, doctor?
Yeah, as you have not ever fathered the baby, so it most of and it will be funded by the NHS. However, we need to contact the local commissioning groups for the same. As you're not smoking, your weight is okay, and you have not either of you have not parented a child. So most often it will be funded, but for that we have to contact the local commissioning groups for the same. Okay.
Okay.
Yeah.
Uh,
And do you have any more questions to ask or
yeah,
clear?
doctor. Yeah, I just wanted to know regarding the success.
Yeah, its success, it depends on many factors like the patient's age. Okay. So if it is less than 35, it has been seen to be success in around 30 out of 100. It also depends whether you're smoking, what is the weight, okay, what is the weight to height ratio. So it has got different success rates depending upon the age of the female. Okay.
Yeah, doctor. Thank you.
Okay, I'm giving you this written information. You can just go through that, and I'll be arranging a tube test for you. And okay, is that fine?
Okay, doctor. Thank you.
Thank you so much.
Okay. So your own reflection. Anybody can comment on her performance, and then I will give my feedback. Your own reflection. Time management is one thing, but
Yes,
anything
ma'am.
else?
Mm.
Yeah. Anything else which you think?
Yeah, I could have explained the patient maybe that tubal test is important as she has underwent a previous surgery. So we need to check the patency of the tubes for her
You mentioned
before.
that. You
Yeah.
mentioned that. Mhm.
Mm, and other options like there is an option of adoption also.
So,
Um, what
okay,
else?
you can say, no worries. Adoption and fostering is also there.
Mhm.
Uh, what means, anybody would like to comment on her performance?
Perfect, ma'am.
Okay. Mm, anything which she has missed out could have been addressed.
Partners, working place. And
Support.
Occupation.
it's occupation.
Age of partner है? Age of partner
But
है?
everything is fine in him also. Any
Age of
medical
partner.
conditions in their
Yeah, no,
partner.
partner history is still okay.
Okay.
Anything she has missed out on means
Support
sometimes
groups, ma'am.
support group, yes. Occupation
And
you missed
counseling.
out.
Yeah, occupation I
Occupation.
missed.
Okay, because that is safeguarding of a child. That is also one
Mhm.
of
Yeah.
the important thing when it comes to IVF.
Yeah.
Counselor, did you mention?
No, I forget that. Counselor and support groups.
Subfertility
Actually, I
counselor.
was about and I was just winding up.
Okay. Now, one more point which you missed out, dear, was uh, I was not happy being referred so late. It took almost 1 year of referral. So this is a sidey thing, but if the lay will be there, for them it will be a big thing. Okay.
Mm-hmm.
So
Yes.
if the 1 year of time will be there, did you reassure me that at now onward your treatment will not get delayed? We will ensure that, and we will see to
Mm-hmm.
it why it was so much delayed. A
Okay,
simple
ma'am.
line, a simple
Yeah.
line. But if Lay will be there, he might not like it.
Mm-hmm.
Okay.
Yes. Yes,
The
ma'am. You're
way
right.
I was angry for what? I was angry for that thing, but you have not commented about that situation. You just acknowledge the situation, but not said, not reassured what you said. Just means one or two lines that this will not, we will ensure this will not happen, or for means here onward, and we'll look into the matter why it was delayed so much.
Mm-hmm.
Okay, so this might be a star point in lay examiner's communication with patient and family.
Mm-hmm.
Okay, so this is one point which you had missed out. Interpreter, okay, I will not say, means, yes, you have acknowledged at some point of time. Good, very good. Now coming to from the starting, okay, time management is the biggest problem with you asking why you took so much of time for every sentences or every alternate sentences, paraphrasing and ensuring okay, fine, all right, then oh, that's nice. At every sentence, after every one or two sentences, you used to mention this point. So
Mm-hmm.
this will cause you, dear, some time. You just
Okay.
listen, and whenever you thought of speaking something,
Mm-hmm.
just nod your head. Because
Okay.
here we are not seeing each other. In the real exam, you are seeing your role player. So not necessarily you need to say okay, all right, every time. Whenever there is
Mm-hmm.
some significant information at that time, definitely you are going to acknowledge it. You are going to say some soothing words, but not every time, dear.
Yes,
This
ma'am.
will,
Yeah.
okay, so this will cause you your own time. You
Yes,
can,
ma'am. Great.
okay, yeah, so that is causing you just listen to the recording how many times you send this okay, all right, and very nice, that's nice, all those sentences. Okay, uh, that is one thing. Examination is not needed in this case. Whenever in RCOG what they practice, if the patient has come to discuss the report, they do not expect you to offer the examine the patient, even if it is a ANC patient. Okay,
Okay,
you
ma'am.
just ask
Okay.
well-being of mother, well-being of fetus, whether the baby is moving. Still we are
Mm-hmm.
used to having that antenatal patient examining. I will say, to be on a safer side, you can just tell her that I will ask midwife to check upon your BP and your baby's heartbeat. Okay, so you can just say this, but whenever they are there to discuss the patient's reports, nobody examining, so not needed. Mental history, why you think I am depressed, I am sound, I am not depressed, so do not ask this kind of history. Again, your time will, you have to stick to a relevant history. You have to stick to a relevant history. Kid folic acid, okay, that is one point. When actually there was a mismatch when I said I am vaccinated and the rubella antibodies are not seen. So you got confused here. You can just say, okay, you might need another dose of vaccination. You can just say that at that point. If you are
Okay.
confused, okay. If you are confused, this kind of situation comes up, then just say that, okay, we may have to offer you another dose of antibodies because antibodies are not seen in your blood, okay.
Hmm.
And then another ARH negative, that means what? You will be requiring anti-D if you will get pregnant.
Pregnant, yeah.
That is one sentence you can say, but it is okay if you this will be a small sentences which you can say, which you may not say. Now coming to explanation, dear. Okay, now again your time actually. Did you check my background knowledge that I am aware about report or not?
No, I just sorted whether there's a consent of partner is there or not.
Yeah. So whenever patient comes to you, although I mentioned somewhere in the beginning only, I am not aware what are those reports. But still, okay, here I mentioned that I am not aware, but in the real exam, you are supposed to check whether you are aware about patients. Are you aware about your report?
Mm-hmm.
That is checking background knowledge. Whenever you are explaining to a patient what she's having, that is unexplained or tubal fertility, tubal factor fertility. Again, you are supposed to ask them, are you aware about this terminology? Okay, you asked me, do you want me to explain you in detail? This sentence you used for me, but you didn't check whether I am aware about this condition. Okay, in as explained and tube test. Whenever you said about tubal factor infertility, so that checking background knowledge about a condition is also very important. So checking background knowledge about report, checking background knowledge about condition, these are two important points. And then you started explaining me about HSG, which took another 2 minutes of your time and you couldn't complete. If you see the task as a whole, you just could started explaining me regarding unexplained infertility, what is unexplained infertility. But the main task, addressing my concerns, giving me options, those all parts were totally missed out. So for that, you need to work out your 10 minutes time. Your task should be completed within 9 minutes time. Your history in infertility module, yes, 4 minutes, 50 seconds. Your history almost took 5 minutes, 50 seconds. I will suggest 4 minutes 30 seconds should be the maximum history. Half a minute for explaining the reports. Okay, quickly. Now, yeah, you can communicate very easily. So communicate easily, quickly explain her what are her report says, and
Mm-hmm.
then explain her the condition. Now, in this case, what I would have suggested, in looking at your history and investigation, uh, means the probable reason for you not getting pregnant, either it could be a tubal factors of fertility or infertility, since your tube test is not available with me, or a unexplained infertility if tube test is normal. Okay, if tube test is normal, then it will be a tubal factor infertility.
Oh.
It is unexplained infertility.
Um,
So if it
yeah.
is unexplained infertility, because things are everything is normal. Now how you will be taking in the real exam, that this task they will not suggest tube test, saying tube test for her, this patient. Anyway, she has completed that 2 years window. Looking at her history, only appendectomy, that too she was quickly taken for surgery because she was in the hospital. She is a nursing staff working in a hospital, so she was quickly took for a lap surgery and means discharge very next day. So that means having a tubal factor problem with this patient is very unlikely. Okay, so that is a way they are just trying to say that looking at the history, less likely you are having a tubal factors of fertility. Most probably it is a unexplained infertility. It is a task in real exam. So in real exam, if you are saying HSG, they might means fail you in patient safety. Anyway, unexplained infertility patient goes directly towards the what is a treatment for unexplained.
It's an IVF. And
Yeah,
IVF.
yeah,
Ma'am, please show the first slide. I could not. I have not read the question. Thank you, ma'am.
yeah. So IVF is a mode of treatment for unexplained. Even if it is a tubal factor, the mode of treatment will be same.
Same.
Yeah. So if it is in an exam saying HSG may deduct or may harm your performance. Hmm? Remember that, but you are definitely going to give the differential diagnosis for this cause of subfertility or infertility, that is unexplained, and second is tubal factor. But looking at her history, I am not suspecting any tubal factor, infertility or subfertility. So most probably it is unexplained. Now, what is unexplained? Everything is normal, no reason found. Meanwhile, you can keep trying. Sometimes meanwhile, you might get pregnant. When I said folic acid, what should have been your sentences? Okay, all right. Rather than saying okay, all right, I will suggest you please continue that.
Mhm.
Hmm? Okay, all
Yes.
right. Yeah. So ensure you will say you will write use a right sentence at that point. Please continue that. That will be my sentences when I said okay, I'm taking folic acid. Yes, I'm taking folic acid since last 1 year. Please continue that. Hmm? So these are my sentences. Now, IVF. Yes, IVF. Yes, you explain me what is IVF. What are the funding issues? Yes, looking at it, I am aware that most probably you are eligible, but I need to confirm. Now,
Mm.
anybody can tell me what is a newer terminology for clinical commissioning board, clinical commissioning groups?
ICP perhaps. Uh,
Yeah, integrated care board.
integrated care board. Yeah.
Yeah, so see to it that you will use the newer terminology because since 1920, sorry, 2022, they have started using this terminology and now it will be ICB only. Mm. So these are small things, but for them it matters a lot. So that is one thing.
Actually, his husband's name was also different there. It was Anish, and there it was Samuel John. I thought it's something.
No, 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 it's okay. It actually, see, in the book
Ma'am,
actually, mm, in the book actually,
in this.
it was written Anish, but I was having these templates of blood
Oh,
investigation. Okay, so
yeah.
I just mentioned, okay, so I just mentioned it, I just took it because in the
Yes,
real exam, you will have a task where there will be multiple papers, three,
yes,
four
ma'am.
papers, and your eyes should get accustomed to seeing those many investigations within that 2 minutes of time. That's the
Mm,
reason I have given in this format. Otherwise, in the book, they have just mentioned one line of that particular investigation normal, one line of the other investigation normal. So I wanted to give you people some exercise to your mind, some exercise to your eyes. And that's the reason this way I have started doing it. Okay. So it will
Thank
give
you, ma'am.
you,
Thank you.
yeah, it will
Yeah.
give your eyes a stimulation. Okay. In the real exam, this will be like this also. It will come up in that format also. I'm not saying. But then if other format is easy for our eyes, but this kind of
Mm,
things when come now, our mind gets clogged. We will not be in a receptive mode.
yes,
Okay.
ma'am.
So that's the reason. Um, okay, now what we need to see. So that is what I wanted to tell you. Now unexplained. The next of the rest of the part you completed very nicely. That IVF success rate depends upon multiple factors. But since less than 35 year, 32% is the
Yes.
success rate. Yeah, chances of OHSS, multiple pregnancy, miscarriages, ectopic pregnancies. I didn't mention miscarriage or ectopic pregnancy. I just mentioned OHSS and multiple pregnancy. But yes, you can explain all the option, all the things. And the journey is very overwhelming. There are chances you might not get pregnant in spite of everything. So a counselor will be a part of this journey, including your fertility specialist. Hmm? So that's the reason here your support groups are very important to be in touch with, to have a positive experience, to be in touch with your support group. Okay. Now my answer key includes introduction. So in the beginning only, dear, they had mentioned that is situation here. 2-year history of failure to conceive. Uh, Her husband is Samuel,
40
who is
years.
businessman and is away today. They have been referred to the unit from a small district hospital where they had series of investigations. The first went to hospital a year ago after trying for 1 year unsuccessfully. Following investigation, they were simply asked to await referral to your unit. So almost 2 years of referral. Okay. So now this is actually giving you a clue that okay, so this is a situation where patient has been had a very delayed referral. So here situational awareness is that apology for waiting too late, and I will ensure that here onward your referral will not get delayed. We will ensure and we will look into the matter why it got delayed. That is one thing. Agenda: discussion of reports and further management. Gathered from the GP letter. Okay, so GP letter has mentioned whatever. Ask. My concern is because I'm getting delayed reference. I am very disappointed, and my clock is kicking, and I may not get pregnant. So I'm worried about that. So then, first question was okay. What treatment you have tried? Are you aware about fertility window? Is another question which one should always ask. Are you planning a regular intercourse around the time of fertility window? Okay. So please ask this question. This is most of the time is a star question. Folic acid. Oh, sorry. Here it is not BMI is less. It is,
It was 27 in the question,
yeah.
right?
In our case, it was, no, she was 24. Hmm.
24, yeah.
Okay. 25, we will mention. So normal dose folic acid. Hmm. Menstrual history. Again, you hear what you asked me. When was your last period? Please ensure you will ask your open question first, then see to it. Is it regular? When was your last period? If I am not telling, because I have been instructed, if open questions will be asked to me, I will give you complete answer in one sentence rather than allowing you to ask me any question, any further question. Okay. Then contraception, have you used ever IUD? Because you are here now, again you wanted to rule out any risk factor for tubal pathology. So if you can ask, it will be good. STI history you asked, surgery history you asked, allergy you asked, smoking, occupation, BMI is very important. Sexual history, frequency of intercourse, difficulties, aware about fertility window. These are the only history. Now regarding partner history, age has been mentioned.
It is
I
mentioned
wanted,
in the.
yeah, age has been mentioned. I wanted to know who is this Kumar Madhavan. Okay, last time also he was there. Uh, So age of the partner is has been mentioned. So now, is he fit and fine? Because you are having very less time. Only few question you wanted to know whether he is fit and fine. BMI, smoking, occupation, and previous kids. Okay, so these are the only questions. If you think you can ask, this much you need to ask only for the overall well-being of a family, overall fertility referral. And then any significant family history you can ask. If you think no, you do not have time, you can skip, because it is not going to hamper your this module per se. This module is not going to get hampered. In high BMI cases, you can ask. Where the BMI is very high, you can ask, because that is having a chances of diabetes, diabetes, hypertension, PCOS. So if it is there, then those things runs into your family. High BMI cases, you are going to ask family history, but in other cases, in male infertility, OHSS, no need to ask, what I feel. Do not, if you are having time, you can, but otherwise do not. Check background knowledge. Now I have assured about confidentiality. Why I have assured her about confidentiality? She is nurse by profession, working in a hospital.
Mm.
So I will not be discussing her case with any one of my colleague. That's the reason I have assured her about confidentiality, and partner given permission to discuss my report. Name and NHS number, this belongs to you. Report one by one. Tube test not done, can be offered. I have mentioned here in the exam, they mentioned that since it is unexplained, tube test might not be needed. Hmm? So type of subfertility or type of infertility in her case will be either unexplained if tube test is normal, or tubal factor infertility. But looking, my sentence here will be looking at her history, less likely that she will be having any abnormalities with her tubes.
Mm.
Okay, so now what you are going to start. So reassurance will be the first thing. Yes, one out of seven couple find it difficult to conceive because of various reason, and in one out of four couple, we may not get any reason why they are not getting pregnant. But do not get stressed out. The options are available. Would you like to discuss? Yes. So if it is unexplained infertility, that means no cause has been found out, then after awaiting for 2 years, you are directly you have been referred directly for IVF.
Mm.
And I will ensure here that it will not be there will not be any further delay. Hmm? Meanwhile, she can continue to have a regular sexual intercourse while awaiting. There might have been a possibility of spontaneous conception. Funding referral to ICB will decide. If at all she may not be eligible for ICB, because nowadays they had many ICBs has cut down their age limit to 35. What has been mentioned when I was reading today ICB. Cost of ICB in the cost of IVF in private, if you go for private fertility clinics, will be £5,000 in private per cycle approximately. So if ICBs may have additional criteria for criteria you need to meet before you can have IVF on the NHS, such as not
Weight,
having
small.
any children already from both your partner and previous relationship, being healthy, weight, having wealthy head, not smoking, falling into certain age range. See here only. For example, some ICBs only fund treatment for women under 35. Okay. So they're having some criteria. Depending upon that criteria, there will be fertility uh, funding. IVF funding. Explain about IVF. Yeah, very nicely you had explained me. During IVF, an egg is removed from the woman's ovary and fertilized with the sperm in a laboratory with the help of multiple medications and modern techniques. The fertilized egg is called as embryo, and then again it was kept back or put it back into the woman's womb. Side effect, I had just mentioned OHSS and multiple births, because most of the time they wanted to listen to this too only. But please, nowadays they are open. You can add repeat means miscarriages, you can ask ectopic pregnancies, you can add failure to get pregnant also. Success rate is 32% for women under 35. This is quoted from NHS. Okay. At a time it might be a very overwhelming, so we will refer you to a counselor, or he or she counselor will be a part of your journey. Any more concerns, you can just close the loop by documenting her care plan for third fertility referral, PIL of IVF, or website addresses regarding IVF, support group Fertility Network. So support groups are Fertility Network UK. These are my support group, and Fertility Friends. These are two support groups. And next time, whenever we can see, we can meet my consultant and your husband can be there, where we can discuss in detail regarding your care plan. So examiner's mark sheet domain by scoring. It includes information gathering. Uh, Focused history. Nowadays they are very concerned regarding focused history, so see to it you will be taking a very targeted history. You should not get deviated. Mental history, if your patient is sound, she is not showing any anxiety, any depression signs, or any irritability or any abnormal gestures, do not go into the mental history. And even if you think of regarding support also, so rather than say asking support, means rather than inquiring about domestic violence, I will ask here about occupation, because safeguarding of a child is more important. If the patient has come to you for infertility, we most of the time we assume that everything is normal with the patient, but any abnormal gesture you can inquire regarding this. Basically most of the time they try to give you all those points. Specific information relevant to possible cause of infertility. So tubal factor infertility, you have to ask the history, especially IUCD history. Interprets correctly, explain the investigation result and their implication. A certain anger and frustration at the delay in referral to the larger unit. Ensure that the couple will provide safe environment for child. So this is all your information gathering. So last 2 points, means you could able to take out the history that I'm angry or frustrated. The last point only you couldn't able to ensure. Applied clinical knowledge, sound and comprehensive evidence-based knowledge are, for on and explain infertility, interprets, explain clinical findings accurately, justify investigation management options and demonstrate rationale for each, comprehensive, well-organized management plan based on history, investigations and taken into consideration various factors. Diagnosis of unexplained infertility is made based on the exclusion of various causes, ovulatory, anatomical and male factor. Knowledge of treatment, especially in unexplained infertility. Now in the knowledge of ovulation induction assisted means conception or IVF, its risk and limitations of this treatment. NHS funding, role of HEFA, NHS funding, restriction, rationale of assisted conception, understanding the role of counseling for infertile couple. So it is getting tested in this module also. Counselor will get tested in communication with colleague module also. This is nice guideline which has been there since last updated in 2017. Patient safety first will always be there. Risk management, delay in referral and clinical governance. So this is very important. This is my patient safety also. Okay, important points here. Regulatory process in relation to infertility, including issues of confidentiality. If you are thinking, you can assure them a confidentiality. Acknowledge the need to consider the welfare of a child in providing fertility treatment. So all 3 points was not marked by you. Knowledge of the risk of multiple pregnancies associated with fertility treatment, you mentioned. Uh, Inform patient or empower patient to make a make a informed choices. Asserting drug allergies, prescribe safely if appropriate. That is egg allergy, she was there. You acknowledge that. Pros and cons of proposed management in a balanced way. Recognize their limitations. So we means 3 points you missed out. Important 3 points. Communication with colleague, ICB for funding, counselor and fertility reproductive medicine team. Communication with patient, able to give information regarding infertility investigations, treatment options in incremental, stepwise manage, using patient-friendly language, avoiding jargon, which you were able to communicate. Honest about benefits, side effect, complication, outcomes, fertility treatment, understand the psychological need of partner as well as patient. Assure the couple that they have unexplained infertility. Summarize discussion succinctly at an appropriate level and regular intervals. Check that the patient couple understand. So communication with patient, I will definitely give you 2 on 2. A clear pass for that. Any question anybody is having? Shall I end this topic?